My presentation is on the Middle East Respiratory Syndrome coronavirus, which is better known as MERS. About the disease. MERS has a death rate of 3 to 4 people out of every 10 who are infected. The symptoms are pretty general. They were of fever, cough, and shortness of breath. This makes it quite difficult to distinguish MERS without more laboratory testing. It is spread by the coronavirus, much like SARS is spread by the coronavirus. It is on WHO's list of important diseases that quickly need to be researched and have better treatment plans, because it could easily cause outbreaks and epidemics in the future. MERS began in 2012. It is spread through close contact. As you can see by the bar graph of the MERS fatality rate, the global average fatality rate is 38.7%. For Saudi Arabia, it has been 36.5%. In the South Korea outbreak, it was only 19.9%. Prevalence and geographic distribution. So far, MERS cases have been mostly isolated to the Middle East/Arabian Peninsula. However, there was an outbreak in South Korea in 2015. As you can see by the circle graph, there were a total of 186 cases and 38 deaths. So far, there have only been 2 confirmed MERS cases in the United States. This was in 2014. However, these are from global travelers who had recently been to areas such as the Middle East where MERS was occurring. Currently in 2017 and perhaps in 2018, there have been isolated cases and small outbreaks of about 15 people in the Middle East. For an outbreak investigation, I have a 7-part plan. My number 1 step is to create a plan. I will gather a team and establish communication. Number 2, I will confirm the existence. I want to know for sure that the disease is the disease I am thinking of. So I will confirm this medically, doing tests, etc. Number 3 is surveillance. I will gather data on people and cases. I will get this information from the people themselves, hospitals, CDC, local health departments, and agencies. The people on the ground who actually are seeing these cases exist. My investigation will continue with number 4. I will create a study and questionnaire. So I will choose the study design, create the questionnaire. I want to make sure I know how the disease started, what the symptoms are like, how many people are dying, how many people are going to the hospital. I definitely want to see where the disease came from. If it was from travel, we need to start enacting some bans, some medical screenings, quarantine as needed. If it was from someone who got too close to a camel, because often this is spread from camels to people who have interacted with the camel. So if it was spread that way, I need to know that. And if it was spread mainly through person-to-person transmission, I need to know that as well. Number 5, I will conduct a study, and I will also I will also gain specimens. And after the study is finished and I've decided what happened, I will communicate the findings to health organizations and the public as they need to know. And then number 7, the treatment and quarantine, etc. would begin, and these will be based on the study findings themselves. And that concludes my outbreak investigation presentation on MERS. Thank you.